The abortion industry often makes the claim that making abortion legal can actually reduce the number of abortions. And so pro-life people should be in favor of its legalization because it will supposedly make it more rare. But this claim completely contradicts the hard facts. The Guttmacher Institute is one of the most well-known international research organizations that favors the legalization of abortion. It's been officially affiliated with Planned Parenthood for almost 40 years, until 2007. In 1994, the Institute acknowledged that in most countries, it's common after abortion is legalized for abortion rates to rise sharply for several years, and then to stabilize, just as we've seen in the United States. The United States Centers for Disease Control estimates that the number of illegal abortions prior to 1967 ranged from 39,000 in 1950 to 210,000 in 1961, with a mean of 98,000 annually. But within only 7 years of legalization in the United States, abortion totals jumped to over 1.2 million annually. So apparently, making abortion legal increases the number of abortions, just as you would expect. But let's acknowledge that universal compliance with any law has never been achieved. We have laws against stealing, domestic violence, driving under the influence, tax evasion, and texting while driving, and those things still happen. A lot. But we don't use that as an excuse to legalize bad behavior. Another argument is that thousands and even millions of women will die from unsafe abortions if it's made illegal. But according to the U.S. Center for Health Statistics and the U.S. Centers for Disease Control, the actual number of abortion deaths in the 25 years prior to 1973 averaged 250 a year, with a high of 388 in 1948. Certainly not thousands. In 1966, before the first state legalized abortion, 120 mothers died from abortion. By 1972, the year before Roe v. Wade, abortion was still illegal in 80% of the country, but the number of deaths from abortion had dropped to 39. This was largely because of the widespread use of antibiotics to treat infections. But what about the rest of the world? Well, the data shows that legalizing abortion does not reduce maternal mortality. According to estimates from the World Health Organization, UNICEF, United Nations Population Fund, and the World Bank, the 4 countries that decreased their maternal mortality rates the most between 1990 and 2008 are Maldives, Romania, Iran, and Bhutan. 3 of these countries, excepting Romania, have maintained bans on abortion. Conversely, South Africa legalized abortion on demand in 1997. But since then, maternal mortality in that country has risen significantly. It was 410 in 2008, nearly double the rate in 1990, when abortion was still illegal. You can see other statistical evidence in this chart here that legalizing abortion is not what reduces maternal mortality. And by the way, when the U.S. government presents its data on abortion deaths versus pregnancy deaths, they include the number of women who die from abortion in their statistic on the number of women who die in pregnancy, making the latter number deceptively inflated. The World Health Organization did a study of what does cause maternal death rates worldwide. Death rates are caused by numerous factors, diseases like malaria and HIV, which can be aggravated by pregnancy without proper care, infections after labor, obstructed labor, severe bleeding, blood clots. In fact, over 90% of maternal deaths worldwide were caused by factors that had nothing to do with complications from abortions, legal or illegal. You see, the problem is that in the developing world, you have a very poor healthcare infrastructure. There's a lack of proper prenatal care. There's a lack of sanitary facilities. There's often no birth attendant. And if there are obstetric emergencies, doctors or other healthcare workers often lack the equipment or the training to deal with it. Now, I can relate to this issue on a very personal level. When I was giving birth to my daughter in 2010, I suffered a serious complication immediately after my delivery. But because I was in a highly advanced hospital in Seattle, my life was saved. If I'd been giving birth in a village in Africa, the outcome would have been tragically different. So what's the bottom line? Well, if you're living in a country with a very poor healthcare system, pregnancy is going to have more risks. And that's true regardless of how that pregnancy comes to an end. The solution to reducing maternal mortality rates isn't legalizing abortion. It's finding ways to provide women in developing countries with the same level of medical care that I received here in the United States. But regardless of these statistics, I find the entire argument that we should legalize a violent behavior because the people who engage in it might get hurt or die if we don't, to be a very troubling argument. What if I were to say to you, physically and sexually abusing children is illegal, which is too bad. Because if we legalize child abuse, parents wouldn't fear that they would be reported for a crime if they took their child to a clinic or a hospital after the abuse. Decriminalizing child abuse would lead to better follow-up care and even opportunities to educate parents about why they shouldn't be abusing their children. I hope you wouldn't buy that argument. But it contains the same flawed reasoning as claiming that destroying unborn children should be legal because fewer women will die from the procedure. Even if we could achieve 0 abortion fatality rates for the women, abortion will always result in a dead child. And that statistic is unacceptable.